Good morning and welcome to Radio Friends on Tuesday, September the 5th. I want to introduce you to Dr. Katie Murray. Good to have you here, Doctor, from MU Healthcare, and find out that we kind of hail from the same general area. You're from Farmington, Missouri.
Yeah, that's true.
Yeah, and I grew up near Antonia, Missouri, so not too far apart there. But you're here today to talk to us about Prostate Cancer Awareness Month. September is that month, right?
Correct. Prostate Cancer Awareness.
What do we need to know about prostate cancer?
So I think there's a few things that are important. Prostate cancer is common in men, but there is a screening tool that we have for prostate cancer, right? So we recommend that men over the age of 55 talk to their primary care physicians about getting this early prostate cancer screening, because when we do find prostate cancer, it's very treatable.
But is it not true that once you are at a certain age, there's no need, it's pointless to do it?
Correct. So the recommendations that we follow from the Urologic Association, I'm a urologist, is to do screening of prostate cancer between the ages of 55 and 70. So there's some discussion over the age of 70 of the necessity of prostate cancer screening because of what you just said.
Right, because it grows so slowly that if you're over the age of 70, there's a chance you're going to die from something else besides prostate cancer.
That can be correct.
Also, if you are tested for prostate cancer and it comes back positive, that does not necessarily mean that you have it, correct?
So the screening tool that we use is simple blood test, a PSA screening tool. And that blood test then guides us to whether we would recommend a biopsy of the prostate or just some other continuing following of the PSA level. So that would be the test that's done with your primary physician. So we recommend talking to your family practice doctor, your general practitioner about that screening. If they see a concerning level, then they would refer you then to a urologist, someone like myself or one of my partners, to discuss the implications of a biopsy and the potential for prostate cancer.
What do you do then? What if somebody comes in that they're in their late 60s and there's a chance that they have prostate cancer? Are you going to say we need to treat it aggressively, or should we just watch it?
So there's a wide range of prostate cancers, from low risk, of progression to high risk of progression. So that's really what we're going to base that conversation on. I think one of the most important things about prostate cancer is we talk about this shared decision making. So we're sitting down with our patients face to face, just like you and I are doing right now, and we're having this.
And every situation is different. You have to decide for yourself what you want to do.
Correct.
Doctor, thank you so much for coming by.
Great.
Pleasure visiting with you. And if you want more information on this, you can go to the website. It is muhealth.org. Did I get it right, Eric? muhealth.org. I'm so glad that I got this correct this time. All right, and Dr. Katie Murray, thank you so much. Now we have Elizabeth Stevens with us from the Columbia Missourian. Good to have you here, Elizabeth.
Thank you very much.
And I read your paper every day.
Thank you. Good to hear that.
I love the Columbia Missourian.
And we have our new staff right now, so we are cranking stuff out. Yes.
You have really do a wonderful job of covering local news in the Missourian.
Thank you.
I just wish you published 7 days a week.
Yes. Online 24/7, though.
Yeah, I know that. But you're here to talk to us about the Progress Awards. What are the Progress Awards?
Yes. So 3 years ago, we started the Progress Awards, where we are trying to honor people in the community that are moving Columbia forward. So we're looking for those people that you don't hear about very often, that are kind of behind the scenes, but really making an impact on our community. So this will be our third year awarding these, and we're really excited. We had a great group of winners both years, and we just love to read the nominations and hear about these great people in the community doing great work.
So you're looking for people who are really working behind the scenes and are not getting the notoriety for what they're doing. And there are many people like that.
Yes. So we think this can last for a long time.
Exactly. Yes. They are the wind beneath the wings of Columbia.
Yes. So this is not a popularity contest. We accept nominations from the community, and then a panel, which includes our past winners, will decide the finalist for the award. So it is not a voting or a popularity contest by any means. We're looking for nominations, and then it is a decision among editors of the Missourian and the past winners of who is
How many people have you had nominated in the past?
Last year we had 80 nominations.
And what was the most unusual nomination you had?
Well, I'm actually going to go back 1 year. So we have an award called the Sherman Brown Award, where we're honoring, if anyone remembers Sherman Brown at Lindsay Reynolds, he was just a well-known community man that just had a great
He did everything
spirit.
for everybody.
Exactly. So we have an award that tries to honor someone who follows in his footsteps. And the first year of that, then we got a nomination that was for, the nomination just said, I don't know his name, but he's a checker at Schnucks. And if you
I know who you're talking about.
Exactly.
I know who you're talking about.
So yes,
his first name is Tom.
Exactly. So
Tom.
he won that award.
He is one of the most outgoing people that you will ever meet. He doesn't know a stranger.
No.
He doesn't know a stranger. He'll yell out to you from across the floor when you're at the store. So he won the first year.
He won the first year of the Sherman Brown Award. So we have categories in all different areas. So we're talking education, arts, healthcare, social justice. This year we have a new award. It's community nonprofits. So most of our awards are for individuals. We are going to have 2 organization awards this year. So the nonprofit, we found that nonprofits got nominated a lot for individual awards, and so we felt like their own category made sense this year. And then we have a corporate citizenship award that recognizes a company in town.
Okay, so if people want to nominate someone or a company, what do they need to do?
They need to go to columbiamissourian.com/progress, and there will be information about the different categories and then how to nominate in the actual form.
And you can nominate anybody that you feel is worthy of an award.
Exactly.
Then what happens?
So we are going to collect those through October 11th. So the page is live now, and we'll collect those through October 11th, and then our panel will get together to decide on finalists. And then we have a great award ceremony on December 3rd where we announce the winners. We recognize all the nominees and the nominators, and it's at the Blue Note. It's been a great event. One of our winners last year said she felt like she was at the Academy Awards. So
that's wonderful.
It's a great event.
That's wonderful.
Yeah.
All right. Well, Elizabeth, thank you so much for coming by.
Thank you.
And best of luck with this. Again, you can go to the Missourian website, which is
ColumbiaMissourian.com/progress.
Okay. And you can get your news there 7 days a week on the web also.
Yeah.
Okay. Pleasure having you here. Tomorrow, the historic city of Jefferson. Bye-bye.